Wonderful. We will now get started with our session. Good afternoon, everyone, and welcome to today's melanoma cancer conversation. This is a conversation that will focus on melanoma and skin cancer. My name is Idali Cuellar, and I will be moderating today's session. Thank you for taking the time to join us for this important conversation, which will focus on awareness, prevention, early detection, and community education. Before we get started, I want to share a few quick housekeeping reminders. For today's session, we will begin with our medical expert presentation, followed by a cancer survivor journey. And then we'll be hearing about a community partner and their perspective after a recent implementation of our Here Comes the Sun or Sun Safety Evidence-Based Intervention. We will then reserve time at the end of our session for audience questions. If you have questions during the session, you can add them to the chat or you can hold them until the Q&A portion of our session. And we will do our best to get through as many questions as time allows. You will see in the chat a link to our, it's a pre-session survey. We want to ask that you take a few moments to complete this survey evaluation, as your feedback really helps us understand what it is that you are hoping to learn, and it helps us improve these sessions for the future. Today, we are very grateful to be joined by three wonderful speakers, each who bring a valuable perspective to this conversation. To begin, we will hear from Dr. Colin Costello. Dr. Costello is a board-certified dermatologist specializing in melanoma, cutaneous oncology, and supportive dermato-oncology. Dr. Costello leads the Mayo Clinic Melanoma and Advanced Cutaneous Imaging Clinic and the supportive dermato-oncology clinic in Scottsdale. Dr. Costello is actively engaged in cutaneous oncology research, focusing on artificial intelligence to improve the detection of high-risk melanoma populations. And in addition, he is involved in multiple medical societies, resident education, medical education, and mentoring trainees that are interested in dermatology research. Next, we will hear from Dr. Yvette Jones, who will share her personal journey as a cancer survivor. Dr. Jones holds a bachelor's degree in health information management and a master's degree in healthcare administration and a doctorate in education. She is the HIM director and facility privacy official at HCA Florida Putnam Hospital. She lives in Palatka with her husband, 6 children, and 10 grandchildren, and serves her community actively. Dr. Jones is a skin cancer survivor and advocate for sun safety and skin checks. She shares her story with us today to help others understand that skin cancer doesn't discriminate and that prevention isn't complicated. And we will also be hearing from Ms. Connie Smith, one of our community partners, where we recently implemented the Sun Safety Evidence-Based Intervention. Ms. Smith is the Senior Director of Healthy Living for the YMCA of Florida's First Coast in Jacksonville, Florida. She leads the strategic initiatives that strengthen community well-being through innovative, evidence-based health programming. Having spent 10 years in both branch and association leadership roles, she now oversees the association's healthy living initiatives, including group exercise, personal training, healthy aging, chronic disease programs, and medical partnerships. So as you can see, we have a great group of folks here that are waiting to share their perspective and their knowledge with you. So to begin our conversation, I am pleased to turn it over to Dr. Costello for our medical expert presentation. Dr. Costello, thank you for being with us today, and I will now hand it over to you.
All right, perfect. Well, thanks so much for the introduction and for the invitation. let me go ahead and just share my screen. Oh, cool. This is great. Yeah, let's see if I can get rid of. Okay, hopefully. Does this look a little better now?
I don't see the presentation on the screen just yet, Dr. Costello.
Oh, oh no.
It was on there momentarily and then it went away.
All right, let me try one more time. My apologies. Let's try this. I'll share on, I have a few different screens and it popped up initially on a different screen. So let me see if I can swap this
Hmm.
and see if this works a
There
little
it
better
is.
this way.
That looks perfect.
Okay, perfect. Excellent. Well, thanks so much for the invitation. Unfortunately, where my camera is placed and the screen, the PowerPoint popped up on is in a different area. So my apologies if I'm turning my head off to the side to look at the PowerPoint to make sure we are where we are. But we'll go ahead and get started talking about skin cancer. Are you seeing a whole bunch of
We can
all of our
see.
presenter panelists off on the side blocking some of the screen, or is that just on my view alone?
Nope, we can see your slides just perfectly.
Awesome. Okay. I just wanted for background, I do have research support from Merck and do some consulting with Atlas Med. These are melanoma related, but nothing we're going to talk about today. All the photographs that we'll be showing you today are all Mayo patients that consented to having their images shared for educational purposes. When we think about skin cancer, there's three main types of skin cancer. If we get into the nitty-gritty, there are more different rare subtypes, but the three most common are going to be basal cell carcinoma, squamous cell carcinoma, and melanoma in that order. Basal cell carcinoma is the most common type of skin cancer for the majority of our patient populations. These will include non-Hispanic whites, Hispanic Latinos, Asians, second most common in our Black patients. When we look at squamous cell carcinoma, these are most common in our Black patients and our transplant patients. So patients that have had a transplanted organ and are taking immunosuppressive or medications that suppress their immune system. Squamous cell carcinoma is the second most common in non-Hispanic whites, Hispanic Latinos, and our Asian populations. Melanoma, while less common than these other types of skin cancers, is often the type of skin cancer that's more associated with bad outcomes like death. And so certainly it's one that we focus on a lot, although it's a little less common than basal cell carcinoma and squamous cell carcinoma. Here's an example of what basal cell carcinoma can look like. It often looks like a shiny pink bump on the skin, and it can get little erosions, or the top of it can kind of rub off, and then it can bleed intermittently. It can sometimes be sore to the touch. And so those are some of the things to look for. Here's another one kind of hiding in the sideburns, but you can still see that kind of pink bump quality, and certainly there's some roughness to it where it's probably been bleeding in the past. Basal cell carcinoma, in addition to being really pink, can sometimes take on more pigment, and it really depends on how much pigment a patient naturally has. So someone that naturally has more melanin in their skin, they might develop a little bit more melanin in the or pigment in the basal cell carcinoma. So you can still see this basal cell carcinoma definitely is a little bit on the pink side, but there's part of it that has a little bit more brown black in it. And here's another photograph on another of our patients. You can see this basal cell carcinoma still has that kind of shiny quality to it, but much more brown and black. And again, the more natural melanin you have in your skin, the more likely that the basal cell carcinoma will be dark instead of pink in color. And sometimes the cell carcinomas can be almost entirely, dark brown or black, although this is more rare. And this is on a gentleman's cheek. And you can see the zoomed out photo right here. Basal cell carcinomas, they are most often caused by ultraviolet sunlight, although there are more rare things that can lead to basal cells at all that I listed, but we don't need to go over in depth. But really, sun exposure is going to be the big risk factor. When we think about where basal cells are located, both in non-Hispanic white as well as our minority patients, everyone head and neck is going to be the most common place that these develop, which is going to be a little bit different when we talk about squamous cell carcinoma. So for squamous cell carcinoma, this is often the second most common type of skin cancer. And this is often a tender bump, often a little bit more yellow and more crusty look to the skin. And these will be growing and tender over time. They can also sometimes bleed. And here's another one, a little bit more pink, but more crusty, more yellow than the basal cell carcinomas. And here's one, you can also get them on the lip as well. So another area to protect against the sun with your sunscreen lip chap. Squamous cell carcinomas, again, most often caused by sunlight, but there are other things that can cause squamous cell carcinomas too. These include chronic scarring processes, chronic inflammation, human papillomavirus, so HPV. They're importantly the most common type of skin cancer when patients are on medications that suppress their immune system. So people that have had organ transplants, sometimes burn scars, really big burn scars that cover a lot of the body, and radiation can also increase the risk of squamous cell carcinoma. So it's sunlight plus some of these other things. When we look at where squamous cell carcinomas most often arise for our non-Hispanic white population, again, it's the head and neck, the sun-exposed areas most commonly. But interestingly, when we look at on average in our minority population here in the U.S., squamous cell carcinomas are most likely to form on the lower legs and sometimes in the groin if people have different inflammatory conditions. Maybe we talked about that HPV virus as well. Next, we'll switch gears. We'll majorly, for the rest of the conversation, talk mostly about melanoma. Remember, this is a little less common, but this is the one that more likely has bad outcomes. And one of the questions that comes is, well, how often does melanoma develop? And is it the same in all racial and ethnic populations? And when you look, we rate a number of melanomas that occur per 100,000 individuals. And you can see that it really varies by racial and ethnic group in the US. So non-Hispanic whites are the most common individuals to get melanoma, and they develop melanoma about 7 times the rate of Hispanic Latinos and about 33 times the rate in our Black patients. However, that doesn't tell the whole story. This chart is looking at survival or how often people pass away from melanoma. And the further down on the line, the further down on the graph, the worse the outcomes are. And you can see in blue, these are our non-Hispanic white patients. These patients have, on average, the best outcomes, so the most likely to survive after a melanoma diagnosis. And then in red is our Black patients, and you can see that the outcomes are the worst. So although melanoma is more common in non-Hispanic whites, in our Black patients, the outcomes are much worse. So, two different sides of the story. One more slide to kind of, bring those 2 points home because melanomas are so much more common in our non-Hispanic white patients, even though their survival is much better because it's just so much more common. When we look at absolute number of deaths from melanoma in a year, you can see that in non-Hispanic whites, those are the majority of our patients that are dying from melanoma are non-Hispanic white, but other groups are not insignificant either. So when we think about melanoma, I really like to break it down into maybe two large groups of melanoma. In some ways, it's an oversimplification, but I think it helps drive home some points. Some melanomas are caused from sunlight, and some melanomas are not caused by sun exposure at all. And those can be acral melanoma, which is the fancy name for melanoma that can occur on the bottom of the feet, on the hands, underneath the toenails, underneath the fingernails. You can get ocular melanoma that occurs in the eye, and you can get mucosal melanoma that might occur inside the nose or inside the mouth or the genitalia as well. And all of those type of melanomas aren't related to sun exposure. So let's kind of talk a little bit more about melanoma not caused by the sun. And in dermatology, one of the ones we see more frequently is acral melanoma, or these are the ones on the bottom of the feet more commonly. And here you can see some photos of what these can look like. I mean, certainly these don't look like normal things you'd expect on the bottom of the feet, but they can occur in between the toes. It can be more brown or more black, but they're generally become large and irregular spots. They can become tender, they can bleed. Importantly, sometimes they're misdiagnosed as warts or kind of thought to be maybe a bruise on the bottom of the foot, maybe after like a long walk or a hike, but they persist. And certainly something persisting is something to get checked out. Here's some more spots on the bottom of the feet, and you can see, I mean, They definitely don't look like they should be there. But again, if you're not looking at the bottom of your feet, which many people don't, you might not notice if there's anything there. Here's another photograph on the side of the foot here. They can also develop underneath the toenails and the fingernails. And with that, they can sometimes disrupt the nail, like we see on this finger. And then on the toe, you can see that melanoma, that dark spot, is actually growing now off the nail, now growing onto the front of the toe. And so if you see something like that happening, it's another sign that that's definitely a spot that you should have your dermatologist take a look at. So those are acromelanomas. Those are generally not caused by sunlight. It's often thought that they might occur from stress forces or trauma or walking, but the pathogenesis or how they occur isn't fully realized. I think it's still a topic of ongoing debate. A separate type of melanoma are melanomas caused by the sun. And when we think about melanomas caused by the sun, what are different risk factors? These are often going to be sunlight is your number one risk factor. So, spending a lot of time outside, particularly at beach or high UV climates, especially getting sunburns. And we also know that tanning beds are a really high risk activity that increases the risk of sun-induced melanomas. When we think about risk factors, there's some things you can change and there's some things you can't change. So how much sun exposure you get, avoiding sunburns, being careful not only at the beaches, but at high altitude climates, particularly winter high altitude climates where you have a lot of sun reflecting off of snow could be another opportunity to get sunburns. And of course, avoiding tanning bed use. There's some things you really can't modify. You can't modify your family history, how frequently, or your own skin tone's propensity to burning. Having light colored eyes and light colored hair are also risk factors. Another thing you really can't change, but is good to be aware of, is if you have lots of atypical moles. So this gentleman you can see makes naturally lots of big and kind of funny looking moles. If you have lots of big, funny looking moles, you're at increased risk of getting melanoma as well. So what's the best way to protect yourself from the sun? The most sun exposure or the highest UV index occurs between 10 and 4 p.m. So that's the time of day you want to be extra careful when you're outside using sunscreen, at least 30 SPF, hats, some protective clothing, trying to find shade whenever you can, and also can use prescription or sunglasses to help protect the eyes and the eyelids as well. When we think about sunscreen, there's two major categories of sunscreen. One you could think of as either physical sunscreen or mineral-based sunscreen. These are going to be your zinc oxide, your titanium dioxide, and they really help either, there's some thought that they absorb and some thought that they reflect some of the UV light, but they kind of sit on top of the skin. The second type of sunscreen is chemical sunscreen, and these ingredients kind of soak into the skin and then they absorb that UV light so it doesn't damage your own skin cells. And with both sunscreens, recommend reapplying every 2 hours or every 80 minutes if you're sweating. And things you want to look for is going to be at least 30 SPF, broad spectrum, so that protects against UVA and UVB, and then reapplying. If you're outside sweating or swimming, looking for that either water resistant or sweat resistant labeling on the sunscreen. Excitingly, bemotrizinol, this is a new sunscreen ingredient that was just approved by the FDA this year. I don't think I've seen it in sunscreens yet, but it's rumored that it's going to be started to be integrated in later this year. And this will be really exciting. It's going to be a new chemical ingredient that's going to provide better coverage than of certain wavelengths than our current sunscreen filters provide. So it's going to enhance your protection against the sun if you get sunscreens with bertremazole, if you're using a chemical-based sunscreen, as opposed to the zinc or titanium-based mineral sunscreens. So how do you identify melanomas? Kind of shifting gear, looking for how do we identify these spots early? When you think about melanomas, you're often thinking about the A, B, C, D, E's. So A stands for asymmetry. And really, if you're dividing that spot in half, does one side look like the other side? And you can see on the left side of this image, that's definitely not very symmetric looking spot. Those are melanomas. And on the right side, those are moles. And you can see they're much more symmetric side to side. Another thing you look for is border irregularity, so B, and our melanomas often have more irregular and jagged borders, like on the left, and then on the right-hand side, these are going to be more even borders of a mole. When you C is going to be color, so you're looking for often two or three colors in a melanoma, and you can see that on the left-hand side. And then on the right-hand side, in these normal moles, you can see the colors are much more uniform. Next, for D is diameter. 6 millimeters is generally a cutoff to be aware of. This is about the size of a pencil eraser. So melanomas are often quite large, and so they're going to be bigger than a pencil eraser in diameter, while your moles are often going to be a little bit on the smaller side, often smaller than a pencil eraser in diameter, but not exclusively. Another thing to look for is evolution over time. So if you have a spot that's growing, 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 that's a spot to be more concerned about. Besides A, B, C, D, E's, another maybe quick, easy way to think about melanomas is the ugly duckling. So what spot doesn't look like the others? And if you look at this individual's back, you can see that one of their brown spots on their back is larger than the others, and that one is a little bit irregular in the borders, the shape, and then there is some color variation within it. So it kind of hits multiple of those A, B, C, D, E's, but it kind of just stands out compared to the other moles on the back. And that spot was their melanoma. So, in addition to getting your skin checked in person, how would you be able to take a look at your skin at home? So, thinking about self-skin examination, often this is done with a mirror, maybe a full-length mirror and a hand mirror as well. For starters, you can kind of check your face in the mirror, check your chest, your belly, look under your arms using the mirror. Then to look at the back of your head, you can then use a hand mirror with the big mirror behind you. Then you can generally look at the back of your head. You can generally use the same strategy to look down your back, or you could use the hand mirror to kind of gauge, take a quick look at the back. Then in a seated position, you can look at the front of the legs, the front of the feet. Then using a hand mirror, you can then look at the back of the legs and then the underside of the feet as well. Certainly, if you have either a family member or a friend to help you out, that can be a little bit easier than trying to use the two mirror solution. But the two mirror solution is a possibility if you don't have anyone that can help you out. So, what do you do if you find something you're worried about? Take a of it and let your either your primary care doctor or your dermatologist know. So, who needs skin cancer screening as we kind of wrap up? I generally think for the general population without any known risk factors, generally doing your self-screening is a good approach. And then if you see something you're worried about, that's time to either let your primary care doctor know or your dermatologist know. If you have, think about moderate risk, those individuals that are have a family history of melanoma, they've had lots of sun exposure, or they burn really easily, that's when you might want to consider either having your primary care doctor or maybe a dermatologist take a look at your skin. For those that have a personal history of melanoma and or have lots of atypical looking moles like that person's back we were looking at earlier, that's when you might want to be seeing a dermatologist for your skin checks, and maybe instead of your primary care doctor. And then for those people that have had multiple melanomas or have genetic syndromes making them more at risk for melanoma, that's when you might be want to be seeing a melanoma specialist in dermatology. So kind of wrapping up in our last minute, what's some of the research that we're doing? We had kind of in the introduction briefly mention that, now we're really interested in using AI. So on our research team, we're using AI and using computer vision or having the computer or machine learning algorithm look at biopsy slides. And after looking at the biopsy slides, try to predict whether a patient has an underlying genetic mutation that predisposes them for getting future melanomas. And then we're also working in collaboration with Massachusetts General Hospital on predicting who's going to have a melanoma recurrence, who's going to have a melanoma metastasis. And most recently, we just submitted a grant to move from sun-induced melanoma into acral melanoma on the bottom of the feet. So that grant's pending, and that's where we're hoping to take things next. With that, thank you so much, and happy to answer questions after the end of all the talks.
Wonderful. Thank you so much, Dr. Costello, for that wonderful presentation. I personally really appreciate all of the different photographs that you've shared, as it allows us to really see all the different ways that these cancers can present. Very, very helpful. So thank you so much. Um, Next, we will pass uh, the screen over to Dr. Yvette Jones to share her journey as a cancer survivor. It's important always for us to share personal stories, as these stories remind us of the human side of cancer prevention, and what others have done to, get through these a diagnosis such as this, and this type of journey. So, Dr. Jones, the floor is yours.
Good afternoon, everyone. Can everybody hear me okay?
Yes, we can.
Okay. So my journey is one that I honestly really didn't think that I would have this testimony, because I didn't think that minority people get skin cancer a whole lot. My story is I work in healthcare, as was mentioned before. So I do have some knowledge of skin cancer and the importance of prevention and protection. And so growing up in Florida, I don't ever remember my mom or my parents making us put on sunscreen. I honestly, when I was younger, I didn't know the difference between sunscreen, sunblock, suntan lotion. I just thought it was something people put on because they wanted to become a nice brown color. And I didn't think I needed that. So I always have loved the sun. I love nature. I just love being outside. And even as a child, I was inquisitive and I always wanted to learn new things. So I remember looking at something, it wasn't online, it had to be in a book or in a magazine, and they were talking about skin cancer and sun safety, and that everybody should protect themselves. And I think I had to be around 11 or 12, and it just kind of piqued my interest. It didn't really change a whole lot of what I did as far as skin protection. I do remember, like, if I went out to the beach with my friends and they had sunscreen, I would use it, because I knew that there was an importance. There was an importance of being able to protect your skin. It wasn't until I became an adult that I really took it seriously, and I didn't apply sunscreen every day. But if we went to the beach or if we went to a field trip somewhere where I would have long periods of exposure to the sun, I would definitely put it on. Now, I tried several kinds. I tried the lotions, which to me was kind of chalky and it left you kind of white. Tried the clear gels, and that worked a little better until I came upon the spray. And so I would spray the sunscreen on. It wasn't until later, after my diagnosis, that I realized that I was applying it incorrectly, and that could not have protected me as much as it should have. So I'm going to talk about some of the signs that made me seek treatment. And it was similar to what Dr. Costello said. It was like a brown little, well, it wasn't really brown, it was more yellow looking, little pimple thing. So fast forward to 2024, I noticed this little pimple on my inner forearm. Initially, I thought something may have bitten me, because we live in Florida with all the insects and bugs. However, the bump, it was very hard. It was hard and it was white. I tried to pop it thinking it was a pimple, but it was so hard it didn't budge. Um, I went probably for about a few months and kept looking at it. I kept telling my husband, I said, "Do you see this? This thing won't go away." It didn't really change in color, it didn't change in size, but it just would not go away. So after about 6 months, I made an appointment with the dermatologist. And I don't know if I have presenting capabilities, but do I? Can y'all see if I put up a picture? Let me see if I can share my screen. Can y'all see that?
Not quite yet. Oh, there it is. Now we can.
So this is what it looked like. Can y'all see that?
Yes.
That little pimple, like, it was so tiny, but it was hard and it was white. And it just would not go away. And so I went to the dermatologist. I made an appointment, and I had not, I had been to to a dermatologist before because I don't know if you can see it. I have this birthmark that they like to monitor a lot. And they want to see if it's changed any shapes or if it's doing something different. So I've been in the past, but I've never had a full skin check. And so when I went in for that particular bump, they did a full skin assessment, which was awesome. They did from the top of my scalp, they looked at my scalp all the way down to the bottom of my feet. And they were able to identify different areas that might need attention. So in that appointment, there was some concern about the bump. So the dermatologist wanted to do I think it's called a shave biopsy, where they actually shave off part of the tissue, to analyze it under a microscope to see if it is malignant or cancerous or not. And so they did that, and it didn't really hurt. Like it was like a little local anesthesia. It didn't hurt too much for that. And so about a week or so later, they came back and they brought me in, and they said that the biopsy indicated that it was squamous cell carcinoma in situ. I didn't really know what that was. I knew that it had something to do with cancer because, my healthcare background, but I really didn't know what it was. So she explained to me that it was cancer, but it was very treatable. And I guess the treatment for it is that she wanted to remove it or do an excision to remove it. And she said she would excise that part and the surrounding tissues to ensure that she got all of the cancerous cells. So that procedure was a little more uncomfortable. And so with that, I came in and they cut it with the scalpel. They removed all the area that they wanted. My husband took a video. I just recently watched it. It was, I can't believe I sat there and just did that. But anyway, they gave me local anesthesia, and then they were cauterizing it as they went along, which is kind of burning it. The main thing I remember about it is you can smell the burning flesh. That was not a fun thing. But luckily, they were able to do all of that, remove it, stitch me back up. I have a minimal scar now, but they removed all the cancer. And so I was very thankful for that. So during my skin check, the initial skin check, they also found an area on my hand, like the palm of my hand, that had been there for years. I mean, since I was a child. I think I got stuck with a pencil or something in my hand. But the area, it created like a dark circle. And thinking back to what Dr. Costello said, it caused them some alarm because they thought that it could have been a melanoma. It was irregular in size. It was that dark color, and it was on my hand. And it was funny when Dr. Costello said that the squamous cell carcinomas, normally on minority people of non-Hispanic origin, is usually on the lower region, and mine happened to be on my arm. But anyway, they did all of that. Unfortunately, the one on my hand, I had to get it biopsied twice because the first time they did not get enough tissue. So that was a little uncomfortable. But thank God it came back as not being melanoma. And I was really scared about that one because melanoma is the one that's more serious and could lead to death. And so I was just thankful that I had enough knowledge and enough intuition to actually go in and make an appointment. So now, how does my life look after this diagnosis? I tell people, especially people of color, because I want people to know that this is a possibility. That we also, even though we have all this melanin in our skin, even though we are minority, we still are susceptible to skin cancer. And so my goal is to get that information out to people and let them know to make appointments with a dermatologist, get a skin check, do your own skin assessments, and that's what I do. But I limit my exposure to direct sunlight. Even though I like to go out, now going out for me means putting on sunscreen, applying it appropriately. Because as I told you, I did like the spray sunscreen. However, I just sprayed it on and went about my business. What I should have done was sprayed it on and rub it in, make sure I reapplied it. So I probably wasn't applying it the correct way. I also, like I said, regularly check my skin for any changes, any like moles that I have. I check them to see if they've changed in any way. Um, I also, like I said, I wear this sunscreen, and even like the moisturizer that I put on my face, I make sure it has some SPF in it to help protect my face. And so my main message to other people is to take skin care seriously. Use your sunscreen. Educate yourself on the different types of sunscreen, the different levels of SPF. Teach your kids and your family. As parents, we have a responsibility to protect our children, and that means protecting their skin as well. And so it is important that we protect them and make sure they have appropriate sunscreen and protection from the sun. And I just try to tell people prevention is the key. You have to take the time. Don't put it off. If you see something and it's been there for a while, go get it checked out, make an appointment. And why did I want to tell my story? Basically, just to help others get the message out there that Black people are not immune to skin cancer and it can happen. And that's really all I have. I want to thank the Mayo Clinic for the opportunity to share my story. And that's all I have.
Thank you so much, Dr. Jones. That was a wonderful testimony. We appreciate the information that you have shared with us, and definitely something that we hear in the community very often. I have darker skin, so I don't feel that I need as much sun protection as other people, but we have seen time and time again how that is just not true. We all need to be very vigilant and do our best to protect ourselves. And as you mentioned, the younger kiddos and just spreading that knowledge and awareness. So thank you once again for sharing that. Now I invite Ms. Connie Smith to share the community partner perspective. Ms. Smith, we look forward to hearing about your experience and your reflections from the community setting.
Sure. Thank you very much for inviting me. So I work for the First Coast YMCA out of Jacksonville, Florida. So we service the first 6 counties on Jacksonville in Northeast Florida. So sun protection is extremely important to us, but it goes into our mission of healthy living, which is one of our 3 pillars: youth development, healthy living, and social responsibility. And we believe that it is both healthy living as well as our social responsibility to educate the public on things that they can do out of their own, where they're not necessarily even having to come into a Y to do it. The Y's mission and our YUSA of the USA, the YMCA of the USA actually recently started to partnership with AstraZeneca to start to do cancer screenings as well as education. So as part of that partnership, we're always looking for other partners to partner with. And when Mayo came to us and said, hey, we'd like to educate your staff on sun safety so that we can educate other staff as well as educate the public who is coming into the Y, we jumped at that opportunity. So on June 4th, we held a Train the Trainer for our Y staff. So the folks over from Jacksonville Mayo Clinic came to one of our branches. It happened to be the day that we held a Healthy Living Director meeting. And we also brought in some of our Healthy Aging coordinators. So those are the individuals who work with our 65 plus community. And they do a lot of different things, bingos, potlucks, birthday parties, and a lot of it is also education. So we took that opportunity to make sure that we could educate our staff, who could educate other staff, who could educate the public. So it really was something that was a little bit further down the line of like not just us and we walk away from it. We wanted to educate others. So we held trainings within our branches for the staff that did the training that Mayo Clinic came out with. And we talked to other healthy living or healthy aging coordinators, gave them the PowerPoint presentation, gave them a few of the pointers that were part of the education that was provided, and then actually gave them a few incentives as well. So the Mayo Clinic bucket hats were a very big hit for both of our staff as well as those who we later went on to, and that public who we later went on to have educational sessions with. One of our branches is one of our largest branches in Jacksonville is our Winston Family Y. They receive over 500,000 swipes every single day or every single year. From the public who go to that. We have a large 50 and better population. So we started with a pilot there and held a talk with a healthy aging coordinator about skin cancer. And our healthy aging coordinator went through the PowerPoint presentation, and she had 30 people who came to it. We didn't serve them lunch or anything, so having 30 people who wanted to learn more about cancer prevention from a sunscreen, from the sunscreen, as well as screenings for themselves and what to do if they have any questions is really great. Usually they come for food, but we're learning that they actually come more for education in that community event as well. We gave away some of the bucket. We didn't tell them in advance, but we gave away some of the bucket hats, some sunscreen, some umbrellas and things like that, both from Mayo Clinic as well as the Y. We also made sure that we educated those individuals who are outside in our outdoor pools who have direct communication with some of our public. So we held a train the trainer with our aqua aerobics instructors so that they could have, and a lot of them are also part of our healthy aging, they could have that same information to pass it on to the participants that are in their classes. We know that people come in, they go directly to their class, they get into a pool, they are out there for 45 minutes to an hour, they stick around, talk, have lots of conversations, and we actually never see them put on sunscreen. So we never knew whether or not they were coming in with the sunscreen on, or they just didn't think that there was anything about it. So we held small snippets over a couple of weeks that we just gave them that sun and education that we had learned. We didn't do any PowerPoint presentations, but we started to ask them questions. Did you guys put on your sunscreen? Did you put it on before you got into the pool? Was it 5 minutes before you got in the pool? Or did you literally just put this on and then got in the pool and it all wiped or rinsed off in our pool? And just those type of small little things before they even got into the pool or as they were getting out of the pool went a long way. We also gave them out some Y bucket hats and some baseball caps and some hats that they could start to wear in the water. And we started to see more and more people as the summer has gone on. More and more people are out there with hats on. So it's sticking and that education is sticking. And then we went a step further. We know that we have a large opportunity with some of our kiddos who come in for swim lessons. We've kind of always talked about sunscreen. We've talked about what for parents, drowning prevention and what color swimsuits don't work very well that you can't see underneath that water. But we started to ask the question for parents, did you put it on sunscreen before you came out here on your kids? We made sure that they knew, oh, right, I should not have, let my kid into the water without them asking that permission. We should make sure that before they get into the water, they are looking to put on sunscreen and they've put their sunscreen on. We're making sure that they have hats on if they need them, and they're covered before they're coming into our swim lessons or just swimming in the pool. And it's gone a really long way In the past, all we've done is really kind of give out sunscreen, but having that as a part of our swim lessons has definitely had an impact. So they have to ask the two questions: Can I get into the water for my instructor now? And enter the question, Have you put on sunscreen? So WISE can go a very long way in educating the public. We see so many people. We see the community. They don't necessarily have to be a member of our any of the branches that we have or the locations that we have. We do community events. We do community swim lessons, including for our Medicare and Medicaid individuals for their insurance. We have big impacts. So if you're looking to partner with a Y, there's always a Y that is near you. And right now, uh, our Ys in general are really focused on cancer prevention and cancer screenings and cancer education. So now's the time to partner with those that are in your area. I also wanted to let you all know, because cancer is also part of our DNA, and some of our chronic disease programs. Many of the Ys, and I tried to see if Rochester and Valley of the Sun offer it as well. Do believe that they do, but we have a program for cancer survivorship called Live Strong at the YMCA. It's a 12-week evidence-based program. It costs the member and the participant absolutely nothing. We understand that a cancer doesn't just impact one person. As Dr. Jones mentioned, it was her whole family that was a part of understanding the treatment that she was going through and that education. We supply a membership for the 12 weeks for the entire family. So it is the cancer survivor as well as their caregivers and their family to join the Y. And our cancer survivors go through the 12-week program where they're meeting twice a week for an hour and a half each time with one of our personal trainers who are certified in our Live Strong at the YMCA program to really reclaim their life after cancer. So a lot of times when folks are going through chemotherapy, radiation, surgeries, they don't really know what to do after the bell is rang, or, if they've had procedures and they're like, see you later, have a good time. Now go on and do your life. We're that after what happens. And it's absolutely free to the public. You don't have to be a member to be a part of it, of Live Strong at the YMCA. It is a we annual campaign for it, and we find sponsors to provide for that program. We have served over 293 people here in Jacksonville just this year for our Live Strong at the YMCA program, and we have a wait list to get into that program. So if no matter where you are in the country, a Y near you potentially offers the Live Strong at the YMCA program. So if you're looking to be a part of it, because you're here thinking, you know what, I've had cancer, I'm concerned about it, somebody in my family has had it, or you have patients who have had cancer and you're looking for something for them to do next, I highly recommend that you refer them to the YMCA. If you're in Jacksonville, we have a electronic referral system that you can send it to us, and you just have to contact us at the First Coast. Thank you for having me.
Thank you so much, Ms. Smith, for sharing that community partner perspective, which is also very important. And I love the way that, we're able to bring this sun safety education into the community space in partnership with organizations such as the Y, right? It allows us to partner and bring this education to the community in very practical and meaningful ways. And I especially loved hearing about that survivorship program. Because you are correct, right? A lot of patients go through this incredibly difficult journey, and then once that ends, it's like, what now? So having that support is invaluable. So thank you so much for doing that, and it's something that I will definitely look into and see if the Ys in our area are carrying out this program as well. So there you have it. We have heard from all three of our panelists today, all sharing something a little different, but all contributing to this very important conversation. We will now move into our audience Q&A, and I have been keeping an eye on the chat, and it's quite lively, and a few questions have come in already. But if you have any specific questions at this time, please feel free to put them in there. And we have Dr. Costello, Dr. Jones, and Ms. Smith ready to answer these questions to the best of their ability. And while we, wait for those questions to come in, I will point your attention to the chat where my colleague will add the link to the post-session evaluation. So similar to the evaluation at the beginning of the session, this one's a little bit shorter. If you can help us out by completing and providing us with your feedback, once again, this is what really helps us improve these sessions and bring relevant and topics of interest to you all. So I have a question here that I will bring up, and it's for Dr. Costello. What is one melanoma warning sign that you wish more people knew about? So we've heard your presentation and the wonderful information that you shared, but what is one sign that you wish more people were more aware of?
Yeah, I think thinking about if we're going to narrow it down to one, how we define it, the great thing about the skin is it's so visually available, right? So it's really easy to see what's going on in your skin. So I'd say probably the ugly duckling sign, right? So if you see something on your skin that looks different and unusual compared to everything else, that's might be the spot to maybe have your primary care doctor or a dermatologist take a look at. I mean, it doesn't necessarily guarantee it's going to be dangerous, but just like Dr. Jones was saying, right? I mean, that spot on her forearm was different than any other spot she had. And it was really that clued her into getting it evaluated. So I think ugly duckling is maybe the one simplest rule and under the idea of visually looking at your skin.
And yes, thank you for mentioning that. Before you got to that part of your presentation, you had shared several different photographs, and I was thinking how, for somebody that has a lot of different spots, how, do you have to look at all of them, or how can you, distinguish which one is the melanoma and which one isn't? So I really enjoyed learning about that ugly duckling. It's also easy to remember. So thank you for sharing that.
Yeah, and it's tough. It depends on how many spots a person has. Like a patient I saw yesterday probably has about like 4 to 5 thousand moles on them. I mean, when you have that many spots, like that's really tough. But someone who has less, it's a little bit easier. Um, and so sometimes, the patients need help to, checking their spots, and that's what we're here for. But sometimes when people have fewer lesions or fewer spots on them, it's easier for them to keep an eye on it themselves.
Very true. Thank you for that. And Dr. Jones, what was something that you felt helped you feel supported during your cancer journey?
Well, the one thing, can you hear me?
Yes.
The main thing is just the support from my family. I think Connie was talking about it. It affects the whole family. And just having the support from my husband, even sitting there while they were doing the procedure, videotaping it and holding my hand, it meant a lot to me. And just being heard when I went into the dermatologist's office, like they didn't dismiss it as, oh, that's just a little bump. They were interested in my concern because, it had been there for 6 months. And so just being heard and taken seriously when I went in to share that information with them. But definitely the support from people, my husband especially.
Wonderful. Yes, having that family support is definitely super important as it can be a very difficult journey, right, for a lot of cancer patients. So thank you for that. And then a question for Ms. Smith. We appreciate so much the community partners that partner with us to carry out the different initiatives, that we have here at Mayo Clinic, community outreach and engagement. Is there maybe one takeaway that you have from that sun safety session at the Y that you can maybe talk a little bit or expand upon a little bit?
Yeah, I think it is the why and in our daily jobs, we forget about how we impact others, and how we can have conversations on a daily basis with somebody that can change their outcomes, not just from a physical standpoint, but also from a health standpoint. So many times we talk about, weight loss and exercise and cardiovascular. But people are coming into the Y and they're doing things in our pools. So they are exposed to the sun. And it truly is our we need to educate to make sure that individuals who are in our pools understand what sun safety is. And we're an authority in so much of the health that they um for why. So I think that allowed us to take that to another step.
Wonderful. Thank you for that. So this brings us to the close of today's session. I want to sincerely thank Dr. Costello, Dr. Jones, Ms. Connie for sharing your time, your expertise, your lived experience, community perspective, just everything you've shared with us today. Also, thank all of our audience members that took time out of your day to join us. Thank you for that. Once again, if you have not had the opportunity to do so, please complete that post-session survey. There was also a question in the Q&A earlier about the recording for this session, and it is being recorded. We will send the recording link out to everybody that has registered for this session. So whether they were able to attend the live session or not, they will get the recording. We will also be including another link. If you liked this session and you want to keep receiving invitations to future cancer conversations, please click on that link and opt in to receive all information and invitations to our future cancer conversations sessions. So once again, thank you so much for your time. I hope you all have a wonderful day, and thank you once again.